When we think of air pollution, most political responses center around lungs, not brains. Policies are drafted to curb asthma rates, reduce cancer risk, or mitigate climate change, all worthy goals. But what remains disturbingly absent from the global policy conversation is this: air pollution is also damaging the human mind, and ignoring that fact is a colossal failure of public health leadership. We now have overwhelming evidence that air pollution impairs cognitive function, accelerates neurodegeneration, and increases the risk of dementia. Fine particulate matter, PM 2.5, nitrogen dioxide, and O2, and ozone don't just harm the respiratory system. They travel through the bloodstream and into the brain, where they spark chronic inflammation, erode white matter, and trigger the pathological hallmarks of Alzheimer's and other dementias. Yet despite this well-established science, almost no country has enacted brain-centered air quality regulation. We still act as if the human brain is somehow sealed off from the air we breathe, a delusion that is costing millions their cognitive clarity, their independence, and, ultimately, their identities. Governments have a moral and economic obligation to address this. Cognitive health isn't a luxury concern for aging elites. It's a foundation of national productivity, public safety, and generational equity. And right now, we are allowing preventable neurodegeneration to unfold on a mass scale, simply because the damage is invisible, slow, and hard to legislate with urgency. The consequences are staggering. According to the World Health Organization, over 90% of the world's population breathes air that exceeds recommended pollution levels. Meanwhile, dementia is now one of the leading causes of death globally, and the cost of caring for individuals with cognitive decline is projected to surpass $2.8 trillion by 2030. The math is brutal. If we do not reduce the neurotoxic burden of polluted air, we will be drowning in a public health crisis we could have prevented. Fortunately, some countries are beginning to wake up. The United Kingdom has started integrating air pollution data into its national dementia strategy, with researchers from Public Health England identifying air quality as a modifiable risk factor for cognitive decline. Local governments in London have expanded ultra-low emission zones, ULEZ, dramatically cutting nitrogen dioxide levels in city centers, and early data suggests cognitive benefits may follow in high-exposure neighborhoods. South Korea, facing an aging population and some of the highest dementia rates in the OECD, has launched national air purification programs in schools, public transit, and elderly care centers, explicitly linking clean air to mental and neurological well-being. Sweden, already a leader in green urban planning, incorporates cognitive health into its environmental impact assessments, recognizing that fewer cars, more trees, and better ventilation aren't just good for the planet, they're essential for human brain function. Meanwhile, the United States, despite its world-class neuroscience institutions, lags behind. The Clean Air Act remains outdated in its cognitive focus, and the Environmental Protection Agency has yet to formally recognize dementia risk in its pollution guidelines, a damning oversight, given that a 2022 study from Harvard found that long-term exposure to PM 2.5 was associated with a 17% increased risk of Alzheimer's-related mortality, even below current federal air quality standards. This is unacceptable. We do not have the luxury of waiting for more tragic proof. We need a policy shift that frames clean air as a neurological safeguard, not just an environmental preference. That means tighter regulation of PM 2.5 and NO2 based on emerging brain health data, not just respiratory thresholds. Mandatory air filtration and real-time monitoring in schools, hospitals, elder care centers, and public housing. Urban redesign that reduces car dependency, increases green space, and prioritizes walkable, breathable neighborhoods. Cross-agency cooperation between environmental, health, and aging departments, because cognitive decline doesn't respect bureaucratic boundaries. Most importantly, we need to stop pretending that brain disease is purely personal or genetic. When the air in your zip code raises your risk of dementia, that is not a private health issue. That is a failure of collective protection. And if policymakers are still hesitant to act, let's put it in terms they understand. Every IQ point lost, every memory shortened, every decision-making capacity dulled by pollution, that is economic capital disappearing into the wind. Productivity drops. Healthcare costs explode. Caregiver burdens increase. National resilience weakens. It is far cheaper to filter the air than to rebuild the mind. In the 21st century, clean air is not just a climate issue or a child health issue. It is a brain issue. If governments want a cognitively capable population, one that can learn, work, innovate, and age with dignity, then clean air policy must be reframed as a cornerstone of neurological infrastructure. We don't need another committee. We need courage. Because until we legislate for the brain, we're not protecting the people. We're just letting their minds fade breath by breath into preventable decline.